So this morning we have Dr. Stephenie Poris, and she is the only female-owned plastic surgeon in Orlando.
That's amazing.
Yeah, I'm really, I love her social media. I love the content on her website and how she talks about her surgeries and how she talks to women, and she seems super open and connected, and maybe that's because she's the only Orlando-owned business. What's off the table for you? What would you do in terms of plastic surgery?
Oh
what
my
have you
gosh.
considered?
What wouldn't I do?
Really? Okay,
No.
and that's how you feel about it? But.
Yeah, I guess I just need to see how things progress before I can make any decisions. But I'm all about, like, I'm a mix between aging gracefully, but also having confidence.
It's because you've not hit 40 yet. And then
I might change my mind. Give me a few years.
Exactly. Suddenly you wake up and you look at yourself and you go,
oh my gosh,
yeah,
give me her
that?
number.
Excuse my French, that was a really big word. But you know, it really is that dramatic.
It's true.
It hits you that hard. I'm not sure I'd ever touch the knife, never say never, because I might medically need to. I want to know how much of her breast reconstruction is due to cancer or the BRCA gene and, you know, preventative medicine.
I think there's a lot of that now.
I think so. Well, it's 1 in 8, but let's find that out. But yeah, I mean, I did consider having my eyelids done a long time ago because they're kind of hooded and my eyes always look really tiny. But I feel like looking at her site that she does a lot of mummy makeovers.
Yes.
And that's interesting. I mean, I've been blessed, and I do think it's body shape. I do think it's genetics. When I'm on the slimmer side, I actually don't have a belly, so I've been lucky. But then I kind of did have a little bit of a tummy tuck, not on purpose. I had all C-sections.
Right.
And my last one, with two of the most heavenly good-looking doctors that you've ever met in your life. It was like an episode of Grey's Anatomy, whilst I'm lying like a beached whale in blue Wellingtons because I'm having surgery. And these two guys walked in. I looked at my husband and went, that's ridiculous. And they said to me, we're going to tidy up your scar, because I also had the gas switched off. I had my tubes tied when I had my last child. I was only 30. And because I'd had an emergency cesarean, they cut out that old scar and they just tidied it all up and gave me a little smiley face now. And so, yeah, I was kind of fixed. Right. And I didn't even register what they said to me at the time. All I noticed was my bikini line was in a different place once I'd healed.
A post-cesarean section surprise.
Yeah, they were like, oh my God, we feel sorry for her. Let's fix this. And so, two of the hottest doctors I've ever seen on the planet. But anyway, so yeah, I want to know what a mummy makeover is. And I want to know how they approach that. I want to know and I'm just blown away. The fact that you get up one day, you decide you're going to be a surgeon. I've seen her Instagram. I see what she does. I'm in awe.
Yeah. It takes a genius to do that kind of...
And to not be afraid of it.
Not to be afraid, but to just the intricate details.
I can't bring my... I'm not squeamish about blood or anything like that, but I can't bear myself to cut up a chicken fillet. And there's this woman just...
Cutting up humans.
Yes. So, anyway, that's our conversation this morning.
That'll be fun.
Hello and welcome. My name's Carey Sheffield, photographer and CEO of my own successful business. I'm also the host of SheNETWorks, a great believer in lifting up women and loyal supporter to those that are around me. We're all surrounded by incredible women who are breaking the molds in this thing called life. Behind every successful online persona is a real person facing struggles, failures, and living real life stories that don't always have happy endings. We will have an honest conversation, dispel this myth of perfection, and find out what they consider a success, how they achieved it, and learn what they are still reaching for. You are not alone. Join the conversation.
Well, good morning. We're here with Dr. Stephenie Poris, and you are the only female double board certified plastic surgeon in Orlando.
I'm the only female owned and operated.
Owned and operated. I did have the word operated in there.
Yes.
Which I just think is fabulous, and I love that. And we're going to deep dive into that a little bit more because how does that happen? How are you the only owned and operated plastic surgeon? Double board. Tell me what that means.
Yeah. So, well, to answer your first question, there is not a lot of female plastic surgeons. Where we make up about 11 to 16% of the entire plastic surgery population. Good news is we are growing in numbers. But yeah, we're still behind the times. It's a very male-dominated field. And I think as far as owning your own practice, that is also something that today is sort of becoming less and less. You're seeing less doctors go out on their own. They're all being sort of
sucked
employed and big business. Exactly. And so...
what's better for you as a professional? In
autonomy.
Your opinion, really?
Autonomy.
And why is that?
Well, to get right into it, I think the way that healthcare has moved has become very big business. It's become very challenging for the average patient.
I think.
Oh, yeah.
Is in a country and because there's so much money in medicine here.
Correct. There's so much money. And so anytime there's a profit, somebody's not going to reap the reward, and that's the patient ultimately. So being able to have your own practice and have that autonomy and not have to follow that direction of sort of working for,
So we're going to go backwards.
Yeah.
I wanted to just make a big noise about you coming in at the front end because I am in awe. I love seeing your huge big pink posters and billboards. But you're a UF student and FSU, and but you were a cheerleader, a figure skater, and you're an artist. You're still an artist. And we'll talk about how you are an artist.
Yeah.
But you're an artist in what you do. And I kind of got that feeling. We interviewed somebody recently that is a dentist. And she talked about herself as an artist and what she's creating. And clearly you're doing that. And I've seen your social media. I've had a look at the before and afters. And I was showing my husband last night, actually, and he was like, no. And I'm like, yeah, and the mummy makeovers. Yeah. But how does a cheerleader, figure skater, woman who looks beautiful when pink become a plastic surgeon? I don't think, and forgive me, and I'm interested to know, actually, I'm going all around the houses. Maybe too, I'm being sexist in my opinion, and which is terrible. I'm a woman, and this kind of plastic surgery thing, you don't necessarily put the two together. Like you said, it's male dominated, and it's such a graphic, strong, abrasive kind of surgery. Many of them. Yeah. How did you get to this place? I know there was a point I read about you that you absolutely decided. I think it was on your residency that you were going to be a plastic surgeon. So, take me through your journey from college to this point.
Yeah, absolutely. I think I knew very early, which a lot of, pre-med future doctors, they don't figure it out until later. But I was about 18 years old when I decided to be a plastic surgeon. Wow. I had a good mentor. I did a summer away at the Cleveland Clinic in Ohio. Yeah. And they just took me under their wing. I mean, I was in the operating room. I was in the cadaver labs. I knew I liked surgery. I loved science. I loved anatomy. I had some really strong teachers in high school, and even going back before that, science was always a foundation of a passion of mine. And so once I did that plastic surgery experience, it was a whole summer. That was it. I was a smitten kitten. I was like, this is what I want to do. I love the patient population. It's mostly women. I loved working with women. I loved the idea of creating something, a good kind of before and after, and transforming people's lives. So for me, very early. And then I just really never stopped. It's a very long road. So, you just kind of take it a day by day.
But I just love the fact that here you are, pretty in pink. I'm 50, so unfortunately I've been indoctrinated in I'm working against it. I'm all about empowering women. But I love that you still had, a cheerleader, figure skater. I just have this vision of you, this cute petite thing, looking around in your sparkly outfits, and here you are, you want to be a surgeon.
Yeah.
I love that you're going against everyone's preconceived idea of what a surgeon looks like?
I will tell you very much that there was a lot of that along the way. You know, oh, you need to be serious, or you can't wear that, or you know.
Well, you absolutely can, but
yeah.
look what's happening. You know, I've been indoctrinated, and I don't want to feel that way.
Yeah,
and so you're leading the way in changing that, you know, opinion people have.
I had a female physician in medical school, actually, who stood up there preaching to all the female pre-medical students in the audience, myself included, and said, female doctors can only wear penny loafers. And then another experience where I was pulled into a room and said, you can't wear lipstick at the hospital as a female resident
because you're not allowed to show up and be who you are.
Exactly. So you know, I do think that there's a professional persona that we need to maintain, but I don't think we need to completely dumb ourselves down to bland oatmeal.
Yes,
to be taken seriously.
But why do you have to do that? Why do you have to be a certain way, but the man can show up exactly as he likes? Yeah, hang on. Double standard there.
It's a double standard.
But so you then obviously, something happened in Cleveland. Was there a particular transformational surgery that you fell in love with? I have a friend that also went to FSU. They're doing their rotation right now in Indianapolis. He's a little bit younger than you, I think, Raj Chowdhury. But he's going into plastics. The thing that he really has that convinced him, it was cleft palate and and doing the Doctors Without Borders kind of thing and traveling and doing that. But yeah, he's working on that, and also he's doing cosmetics and stuff. But what happened and what in Cleveland that you thought, no, I must have to do this? I know you saw it and you saw the transformation, but was there a particular surgery that was like, wow?
You know what? I think because there wasn't a particular surgery.
Okay.
When you're a plastic surgeon, you are what we say is a master anatomist, because you're not just operating on one area of the body only. We are facile everywhere, head to toe. You have a burn on your foot, you're going to call a plastic surgeon. You have a burn on your scalp, you're going to call a plastic surgeon. So you just have to be good at everything. And so I think that's what I loved.
And you did general surgery. So how long were you in general?
5 years.
Oh, okay.
5 years of general surgery in this country. That's the standard. And then fellowship was after, which is 3 years of plastics.
Wow, that's incredible. And what was your experience working in general? Like your work environment and your growth and your personal experience?
So I will tell you this, that I'm forever grateful for my training in general surgery. I trained here at Advent Health in Orlando. I had some of the best attendings in the world. They strip you down like an onion, and they'll tell you that. They're professionalizing you over 5 years. They're teaching you why it's so important to be at the patient's bedside and care. And, you learn humility and you learn strength, and, you just grow so much in those 5 years. And so I'm forever indebted, because I think it has made me a better plastic surgeon. I see things a little bit more in totality than, if I hadn't had that experience first. And sure, I could take out your appendix, but I don't do that anymore.
And let's just talk about that. So like I said, I've been on your socials and I had a good look, and we talked earlier about what we would do and what we wouldn't do, and some people have no choice and they have to go down this road. So I want to. But there's one particular clip I've seen of you, and I think you're doing a mummy makeover, and I want us to talk about that soon. But I said in our little pre-clip that I have a problem cutting up a chicken fillet, and I'm not squeamish. I'll inject myself, I do all of those things, but I would be absolutely terrified. And you have to be a certain person to be able to go in there and cut a human being open for the good, but to do that, I mean, do you still get nerves about the pre-work jitters? We all have those moments where what am I doing? Like a little bit of an imposter syndrome or something. I mean, I don't know. Clearly you can't as a surgeon. You just know what you're doing.
No, I think that it's actually, you're very right on top of it. So I think that what makes a good surgeon is always having a healthy fear. We are always preparing for every case. I mean, there's always a moment you have to be thoughtful. You have to have a little bit, because you're taking in cosmetic plastic surgery especially, you're taking an extremely healthy patient and putting them under the knife.
Yeah.
And there's a million things that can go wrong, even if everything you do is right. So there's always a healthy fear, no matter what. And I think that keeps us humble. And if you don't have that healthy fear, I think that's where things go wrong. So,
yeah. And you obviously have a team that you work with. When you're operating, do you have to have another surgeon in your presence, or do you just have your team of...
No, I'm the only surgeon in the room. There is an anesthesiologist as well. Who's in charge of, putting you to sleep, waking you up, making sure you stay afloat. And then I've got the team of the nursing staff and my assistant in the operating room.
How was it for you putting a team together like that?
Well,
where did these people come from?
Yeah, I'll tell you, it's a special group of people because it really takes a really just thoughtful team to execute perfection. And so, it's
like a marriage. It must be, especially between you and the anesthetist. I can never say it. That person, the one that puts everyone to sleep. Yeah. Anesthetist. That must be a relationship. I mean, you've got to trust each other, right? I mean,
Absolutely.
A lot can go wrong right there.
It's an extremely important relationship, and it's extremely important that your anesthesiologist knows exactly what you're doing and so there's constant communication throughout the whole case.
And you're not just a woman that's the only one in Orlando that owns and operates a double board certified plastic surgeon. Yes. You were so young. And you went off and did this so young. I feel like you weren't in the field very long before you were out there, and you
wasn't at all.
to go on your own. Why did obviously confidence?
Yeah.
But young family. Did you open your place before your family? Because Dylan and Brody, they're still quite young.
No, so I actually had both my children in training.
Right.
And then, I came right out and opened my practice. I didn't work for anybody else. Definitely, I interviewed around, but I ultimately knew I had the entrepreneurial spirit. I knew what I wanted to deliver, the kind of patient care that I wanted to deliver. And I was a little bit afraid I was going to miss that had I worked for somebody else.
Yeah. Do you think they would have trained the life out of you? And what I mean by that is you had all this... You decided who you were going to be. Yeah. If you go and work for someone else, you're going to have that switched off a little bit.
I can almost guarantee that's what would have happened. And so,
And how did the industry react to you opening? To be the first and the only.
Yeah.
There's got to be a reaction around.
I actually think very, very nicely. I'll tell you that my plastic surgery colleagues in the community, we are all very close. We pick up the phone, we talk to each other, we help each other out. I don't necessarily know if it was always like that, but I have never felt any lack of support from my colleagues. The community itself, I think it was beyond supportive. Yeah, I have just felt love and support from every corner, and I'm so grateful because I don't know. I've never been a business owner. I've never embarked on a financial journey like this, let alone being a new surgeon on the block. And so it was a lot at one time, but everybody's been so wonderful.
But let's talk about the business side of it, because your website and your language stand out different. Where do you come from to already, you want to be a surgeon, you're this woman who's full of vitality and joy, and you project that a lot in your presence. Where does the entrepreneurial spirit go? Because you've got your 1 minute show up videos, and your language that you use, you advocate for people, the work-life balance you talk about, and want something done, ask a woman. You're talking the language that's required, but your site isn't like the sort of place you go to that's like a clinic. It feels like this. It feels like a conversation, and it feels safe for women to go, and it's very nurturing. I don't think I've ever seen or experienced anything like that on even another woman-owned business, but maybe a dermatologist. I've never felt that kind of connection. Tell us where you feel that you've found that. Is it just because you're young and you've grown up with that spirit around you, or is there something in your family that you feel that's rubbed off on you?
I think the entrepreneurial spirit most certainly comes from my father.
Okay.
He was a dentist and owned his own practice while I was growing up. So I watched him do all of that, and I was like, oh, well, if he can do it, I can do it. But again, I think it was, even more of a drive to just deliver something that I wanted for patients. Ultimately,
and
that's
what is
what
it
came.
that you want for patients?
It's everything you just said. It's a nurturing environment. It's a laid back, professional, upscale, boutique, however you want to call it. I mean, I always used to say I wanted to have the Ritz-Carlton, delivered. And I don't necessarily mean like, you get a white glove service every, handed to you, but some place where women would feel confident and that they could be heard.
Because it's so vulnerable.
It's so vulnerable.
Whether it's a choice or not, it's a vulnerable situation to be in. I mean, the fear of just, being opened up in any way. I mean, and then add the fear for women that are also maybe suffering from breast cancer. That it's a double thing. Right. But no, and I love it. And I think how you show up is great. And you've got your own podcast too. And love your videos. I love that you bring your family into it. And I don't want to go too hard in on the family because we do juggle, right? We do all the things.
Right.
I mean, and how does that work for you? I mean,
I figure it out every day.
Yeah. So what does your day look like? How many surgeries are you putting out in a day? And
I have a couple operative days a week. Usually I'm operating from around 7:30 in the morning till 4 or 5 p.m. Multiple patients. Yes. Sometimes cases are long. It's one patient. And then, I wake up, I get dressed, take my kids to school, both of the kids were at 2 different places this year. It was kind of challenging. And then come home and we cook dinner and
it's just,
I call it work number 2.
Yeah, I do. And obviously you've got a family and you're running. We know how all that works. But it's really hard to visualize that you're outperforming miracles in the daytime. And then you go home and you just get, do you ever look at your husband and go, I'm a surgeon, by the way. Like, just so you know, fella.
Oh, man.
And
I'm sure he'll tell you. He has some stories. Yeah. I mean, sometimes I just look at him and I say, I've been standing for 7 hours straight. Like, I just need to sit for a minute. And he's so good. And I think I wouldn't be able to do this without him. I mean, I truly have the most supportive husband. I mean, he is 50-50 partner. He'll help with dinner. I mean, he is really my backbone. There is no way.
He's proud of you.
I think he is. Yeah, I think he is. Yeah. He's just great.
Does he ever look at you and go, I mean, what do I need, babe? What needs to happen?
Yes. It's funny. I've been really trying to go after him with Botox, and he won't let me.
Really? Oh, that's so funny.
But he has decided finally that he wants a Moxie laser.
So I saw this. Yeah. And I'm like, ooh, what is this?
It's great.
And so let's talk about a few things.
Yeah.
Then. I want to know about the mummy makeover, and because that seems like something that you specialize in, and I want to talk about ratios and numbers in terms of breast cancer. Since I've lived here, I've been here for 8 years. I know at least 10 people close to me that have either carried the BRCA gene or have had full-blown breast cancer more than one time. That 1 in 8 number, then I can kind of question that 1 in 8 because there's 10 people around me. And I don't know how other women feel. And I listened to your podcast and some of those women were like, I'm so healthy. I never thought this had happened to me. And I know there are a lot of attributing factors to breast cancer, alcohol, and actually people in a privileged lifestyle tend to be more perceptible because, I don't know, just the way we live. But 1 in 10 for me it is. So what are your numbers like? How many women are you seeing doing preventative and also having to have reconstructive surgery? Do you do the surgery? Do you actually remove the cancer as well as do the reconstruction, or someone else does that?
No. So I work with an oncologic breast surgeon who is phenomenal.
Who is it that you work with?
Primarily Dr. Anu Saigal. And she's a breast cancer surgeon at Advent Health.
In Orlando. Right. Okay. So you work with them.
But I work with a few breast surgeons, but I would say primarily with her, and she's just fantastic. And so she tees me up for a home run.
Right.
She goes in there and she removes the cancer, and she is a phenomenal surgeon. And then immediately during the same operation go in and do the reconstruction.
And so you do that with them?
Yes.
So it's not on your site?
Correct.
What's the process for a woman? I mean, I can't imagine how they come to you. I'm sure you get different people. I'm sure some people are just like stonewall. And because I have, it's funny, I get them before you get them. So they come to me with breast cancer and we photograph their bodies before they leave to go and have the surgery. The youngest person that's happened was 21 and hers was preventative, but she lost her mum when she was 17. She was 98% at risk of getting breast cancer, and she didn't want to live with that time bomb. And because her mum was very young when she died, she was like 40. And so she came and had the preventative surgery. She had a very strange response from the general public around her, her friends. She lost friends because of it. People felt she was being vain, and this could be just an English cultural thing too. Like she was off to get a boob job, you know, rather than rid her body of the potential of killing her, like, you know. But what is the general vibe you get from people that are coming to you? Well, I suppose are you seeing them before the surgery? So you must be planning.
We
because
plan.
It's nipple on or nipple off, right?
Yeah.
And talk to me about what the options are, because some people have no idea. And bizarrely, we all should be paying attention. There are options, but there are a lot of people who are ignorant until it's right there in front of them. Right. And I think if we were pre-warned, if we had this education before it even was on our door, maybe we'd go and have mammograms sooner. Maybe we'd pay more attention.
Absolutely. So, you know, the biggest thing you can do is get a mammogram, age 40, or if you're high risk, talk to your OBGYN. You know, that's stop number one. Yeah. It has to be. Always check yourself. You know, I know there's a lot of misinformation that you can stop doing that. No, you know your body better than anybody. You know what you're feeling. Always, if something doesn't feel right, something doesn't look right. I say this about everything, not even breast cancer. Yeah. You know yourself best. Be your own advocate. Fight for yourself. Don't just, don't go into denial, right? So stop number one, mammogram. Stop number two, a positive diagnosis. You're usually getting referred to the breast surgeon from that point. The breast surgeon's going to see you, have a preliminary conversation about what is necessary to treat your cancer. And usually if there's reconstruction that needs to be involved, that's when they'll come to my office. We'll talk about the type of reconstruction we're going to do, give them all of the options, all the education. From there, we're then seeing them again prior to their surgery. We're going into all the details of the surgery. And then we handhold after. I mean, I see you, the day after. You go home the same day. We don't. We no longer keep any patients in the hospital for what I do. And I will tell you, I think you're back to life really within 4 to 6 weeks. And it's not a particularly painful procedure. But I do think that the mental angst that it brings is immense.
And the psychology behind it. Are women having counselling when they have this done?
Not a lot of them. At least not a lot that have outwardly told me. I do have a few patients that have sought some support groups and help. And I think one of the best things we do as women is when we get together and we talk.
Yes. I mean, this is what this is about. The thing that I think that I'm concerned about, and yes, there are young women, but a lot of the women, by the age that this is happening, they're already insecure more than they ever. We've been insecure from birth, sadly. It's just a female culture. But I get to see that too. We probably have the same client base, but they're already insecure. Some of them feel like their husband doesn't see them anymore. They're insecure about their bodies, and then suddenly there's this, and their femininity. For some women, they feel like they're losing it. I feel like there needs to be some sort of. I mean, they probably needed counselling before all of this happened. Right. But do you ever bear witness to that kind of feeling in a woman? Like she's terrified of the before, the after. So it's not even just about having the cancer. I mean, I remember I was. They thought I had a brain tumor. I had an unusual. I had really, really bad headaches, and so I went and got tested. I had a CT scan, and it was really unusual. My brain had separated. It looked like there was this lump behind my brain, but they said the skull had grown around it, so it'd been there a long time. It's probably benign. You need an MRI. Had to wait 10 days for the MRI. That 10 days was
Probably
horrific.
nightmare. Yeah.
I was a young woman, but the thing that was going through my mind at the time was, okay, so I figured it was probably benign. It had been there a long time, but the thing that was going through my mind was, oh, they're going to shave my head. I'm going to have this treatment. Right. I was just getting myself back to myself. It was all just terrifying, and that sounds so shallow. But, you know, that was a thing. As it turned out, I had a blow to the head as a child. My brain had swelled at the time. The cavity of fluid had stayed there, and my brain had slipped into the cavity. So I've just got a weird shaped head. But a CT scan didn't see that, but an MRI did.
Good.
I'm just a weird person.
But for 10 days, you were a mess.
And the fear and the thing and the insecurity about doing all this stuff.
Oh, yeah.
So... sorry, you were about to say something.
I'll just tell you, I think that fear is something that we face every single day in the office. And I tell my staff this all the time, you know, especially when somebody comes in and you can see they've got a wall up. And this is particular in the breast cancer patient population. They are coming in, they're scared. You can see it all over their face. And so it's my job to bring that wall down and to... you know, and sometimes everybody, right, when you're scared, you might be angry, you might be sad, you might be depressed, right? So,
and this wasn't a cosmetic choice. They hadn't already decided you're going to make me look beautiful.
Exactly.
I didn't choose to be
I would have
here.
never seen a plastic surgeon unless.
Yeah.
And so, you know, and this is honestly why I think I love working with this patient population the most, because it's just like, I can figure out, I want to figure out how do I get this wall down? How do I make this experience for you better, right? We don't always hit a home run aesthetically, okay? This is reconstructive surgery. And, you know, but from an experience standpoint, that's what I think we need to do a better job at as surgeons, as doctors. I mean, the experience is so much a part of it, and everybody's scared, everybody.
If you got to choose, and I know that there are extenuating circumstances, what is the best solution for a person, providing it's available, for them to do in reconstructive surgery post cancer removal? So would you say keep the nipple, remove the nipple, and people need to understand that. I know that the nipple was a choice, right, depending on the cancer that they have. Yeah. But that's the thing that would scare me most. Sorry, I'm
losing your nipple.
I'm kind of fond of my nipples. I don't want to lose them.
For sure.
But yeah.
Well, here's what I'll tell you. So not everybody is a candidate to keep their nipple, depending on where the cancer is, the type of breast you have, et cetera, et cetera. Certainly, if we can, we like to. Okay, that's absolutely become more and more as we are getting better as plastic surgeons at breast cancer reconstruction. I mean, we are taking more and more chances with that. However, if you can't save your nipple, I'll tell you now, the 3D tattooing, the 3D nipple tattooing is, other than you don't have feeling, right? The tattoo is not your normal nipple sensation, but they look so good.
And so 3D.
Good.
So
it's a 3D tattoo. I mean, there's a lot of tattoo artists that are just so gifted that do this, and you can't tell the difference. Really? I mean, I've seen some of these, and I'll tell you, I mean, it's really impressive. And so not all hope is lost, right?
Do you think there's going to be a time in the future when we're actually going to recreate human tissue to the point that we could grow nipples?
I think that the possibilities are endless when it comes to this.
Because I think about 3D printing and all the things that we're recreating, and
I think that the ability to grow organs is absolutely. I mean, they're already doing.
And I know that's derisive, and people that have issues,
right? But I mean, certainly, I think those are all possibilities.
So, cosmetic surgeon. Top 5, what are the things that breast augmentation, I'm sure, cosmetically, but what's in the top 5 for you for what people come to you asking for?
Yeah, so as a plastic surgeon, your patients tend to age with you. So, I am younger, and I'm a mom.
And so I
was hoping you'd say you were 65.
Yeah,
this is what you do, and this is how good you are.
I will hope to look.
I know you're
like
not, but you look fabulous anyway. And yeah, the skin to die for. And I know you educate people on your platform about your skin. But yes, talk to us about the top, top surgeries that you have provided.
I do a lot of mommy makeovers. And what does that mean? That just means combining a breast surgery with a tummy surgery. So
but I've seen
lift,
the removal of fat. I mean, there's one particular before after on there, and my husband said, but she looks really white, and that picture looks really tan. I went, because she put on a bikini because she felt good. That's why she went and got a tan. That was incredible. How long does that surgery take, and how complicated is that?
Great question. So if you're doing a mommy makeover, typically it takes anywhere from 5 to 7 hours, depending on what we're doing. Just a routine abdominoplasty, about 3.5, 4 hours.
And is that no more kids after this?
So I always counsel patients. I mean, you should be done. Yeah. If you got pregnant, I mean, you can still get pregnant.
And stuff, is there?
No, because we're not actually going inside.
So it's not like a cesarean way.
Correct. Correct. This is all skin and fat.
Yeah.
So we're not going on the inside, but we do fix your muscle. And usually with children or massive weight loss, we see it. Your ab muscles separate, and so we do put those back together at the time of your tummy tuck. But also, I think that's probably my number one procedure. I also love the face. Yeah. So facelifts, rhinoplasties, noses. I love it all. I mean, truly.
Do you kind of look at people and go,
what can I fix?
Yeah, do you go home from a party and go,
I'll tell you.
That girl, if I just had her for 10 minutes, I would change her world. I mean,
I try not to. I mean,
and I mean it in a professional. Yeah. I see people walking down the street, and I'm like, I know it's a whole different ball game, but I look at them and go, I need to take your picture, or I love that face and what we could do for that face. Because I know that just having rhinoplasty, can, look at Jennifer Aniston, let's be honest, right? It can completely change everything, their profile. I mean, everything about them in terms of confidence. And it's the same and I'm not sure if it comes into the same place. When people have their jaw protrudes from the bottom, what is that called? I've seen that surgery.
Like a big jaw?
Yeah. When their lower jaw is in front of their jaw, there's an expression
and we do a setback,
and that can completely change someone's face.
Feminizing.
An overbite or something. But so a mummy makeover, breast augmentation. I mean, I think I was lucky. I had more than I needed, so I never had to go down that road. But to be fair, since I've been here, there's not many people that we have here that haven't had that done. And I'm amazed. And I think maybe coming from the UK too, we're very much more conservative. And we probably should fix a lot more than we do, or maybe we don't talk about it as much.
Right.
But I'm surprised to see that.
I think in the last 10 years, because of social media, I think women are talking about their plastic surgery a lot more. It has become more trendy, and more relatable. Okay, it's also really hurt a little bit of our field in the sense that you can't.
There have been extreme cases.
There's extreme,
and I wanted to talk to you about that. Yeah. You just reminded me in a previous interview we talked about. I saw a beautiful young woman that was still very young. But I felt like what she'd done to herself, not just in surgery, but also the way she'd been exercising. Yeah. I felt like she looked a little bit of a caricature of a female form. I don't want to be judgmental, and I know I sound judgmental. No. This was just me looking at someone thinking, Absolutely. I'm sure you were beautiful, but you've now felt this peer pressure to maybe go get implants in your bum and this and this and this, and then there's going to be some point in life when you're 35 whatever, and you look at yourself and go, okay, I look kind of weird now, I don't fit into the life that I'm living now. In that moment, hot young thing, but it kind of carried, but it's going to age out, or is it going to go out of fashion? That's more the thing.
Absolutely. So you should never do plastic surgery to follow a trend, right? There's all kinds. There's, the cat look. There's all kinds of weird stuff. Right. I mean, we're taking out,
You're undoing bad surgery.
We're undoing bad surgeries all the time. And the pendulum always swings, right? Like 5 years ago, Brazilian butt lifts, right?
Yes.
Buttock augmentation. People were coming out with these
doing dangerous
huge
things,
butts,
going to dangerous doctors.
going to dangerous places and chop shops. And one of the number one ways to die with plastic surgery is going and getting a buttock augmentation. And so, if you go to somebody on,
why is
that
that infection?
No, it's actually basically it's a fat embolism. So it blocks off your blood vessels, and you just go like that.
Oh my goodness!
Yeah, but infection. I mean, people are doing all kinds of crazy stuff. But what I'll tell you is, you should never do plastic surgery to follow it, to be part of a trend. Okay. I always say, like, I'm in the face protection program. I want you to look like you.
Yes.
Okay, we're just going to refresh it a little bit. We want to kind of roll back the time a little bit, but we want you to still look like you. And I agree. I mean, I just left a conference where we just, seeing all these latest and greatest cosmetic surgeries and hearing all these people talk. And, at one point it was just like, but at some point you have to stop and say, am I creating a caricature?
Yeah.
And that word was actually used, where you've got this tiny, tiny waist because you've resected the ribs and you've created this large, buttock with fat, and they just don't look like themselves anymore. No. And how is that going to age? I mean,
do you think
when you're 80?
Do you think that's because of social media and what you can do with a filter and people are creating this tiny waist and just all the things.
And body dysmorphia, right? I mean, some people are just never happy with the way they look. And
I know, when they try and transform themselves.
Yeah.
You're a professional woman. You're a wonderful surgeon. How do you feel about surgeons that are out there performing? Well, then maybe not all surgeons, but there are certified surgeons that are prepared to give a woman ridiculously huge breasts.
Right.
Or ridiculously huge implants, or do crazy things to their face. Who are these people, and how are they still operating? How does that make you feel as a professional? What it does for your reputation? You've got to go out there and defend yourself against something that you haven't done. And I feel that way about people that aren't being professional. I mean, how is that allowed?
Well, there's always a patient for every surgeon.
Yeah.
At the end of the day, that's how that's still going on. And most of these surgeons are board certified. I mean, they took the same boards I did and had the same training. But perhaps their aesthetics are different, right?
Yeah.
And the way that they do things. And, there are patients when you're in Miami, right? Miami is a more trendy place for buttock augmentation.
But there was a woman in Miami, putting concrete in people's backsides.
Yeah, I mean, there's a lot of very scary people doing very scary things.
Why? And I don't know much about that case.
It's a $45 billion industry.
But why concrete for all the things?
I mean, at that point, they're just a sociopath.
I mean, I was just about to say, she's just a criminal, right?
Yeah, she's just a criminal.
She's just having fun with people's buttocks.
Yeah. Well, and you always have to do your research. I mean, you really do. You need to look at all the before and afters. Is that your same aesthetic as a patient, right? Does this surgeon align with your values and your goals? And if they don't, most surgeons will recognize, listen, I can't be your surgeon because I don't think that I have the same expectations as you. But some surgeons will just, not.
I know, which makes me sad. What's the most asked question and the most preconceived idea people have about you? Not you personally, but their first time coming to a plastic surgeon.
Okay. Well, if we're talking about facial rejuvenation, I think what I always get is, let's say you're coming in for a lip filler. Oh my gosh, like, please don't make me look like a duck.
Yes.
Or I don't want to be one of those women walking down the street that's like overfilled. I get that a lot. And we, I always have the same conversation. Listen, we are replacing what you've lost.
Yeah.
We are not here to make you look like anybody you're not.
And why does that happen? Why did God decide to give us a great pair of lips and then take them away?
And take them away, like everywhere. All the fat in our face goes away. I know.
Yeah. It's like decide what, lose weight, but it's the face or the butt. And I think, was it Monica from Friends that was, I forget the actress's name, but she said you had to decide. And we all decided to save our bodies and lose our face, I think. But yeah, so, and any preconceived idea that they have about how this is going to work for them. Right. Do you feel that people have unreasonable fear, or they have an idea that, but I suppose you're educating people really well on your website too.
I mean, I think from beginning to end, we're trying to educate. That's like number one. I would rather all the risks and all the transparencies of the operation before, right? Because something bad does happen, you knew, right? You can't say, look, you might get a bleed. Right? But if I didn't tell you that you might get a bleed, you'd be very upset after, right? And scared. But if it happens, you're less scared. You were educated about it. We can fix it, right? So half of my job is really education on the front end.
Yes. You're talking to people too a lot about skincare and what we should be doing to prevent having to come to you in the first place, which is ironic and unusual. Do you think that you are unusual in that you're trying to help people before they even need to come to you?
Yeah, I think so. I mean, I think we have a lot of tools now that can keep you out of the operating room for a longer period of time. And certainly at some point you just have to bite the bullet. There's no doubt. And that's when you teeter the line, especially with facial fillers, where you see a lot of women that their faces just look morphed because they've just overdone it.
People start to all look the same.
Yeah, they do. Yeah. Yep.
And we see it. And I look at a picture of someone and I thought, oh, you would have, if you just left yourself alone, I think that you would have been still so very beautiful. But there is a kind of look.
Yes.
Why is that? Why are people, do they have this particular face that seems very similar?
Yeah. Well, there's a few reasons. One, I think people want to stay out of the operating room, so they're willing to go at great lengths to do that and fill and fill and fill and fill, if we're talking about filler. I also think that people are going to board certified plastic surgeons, not even plastic surgeons. I mean, there's a million med spas.
Cosmetologists that will
I mean, there's how many med spas are here? I mean, there's 50.
There's no one that could drag me in there. If you're not board certified, I'm not coming to see you.
So
if I can't believe people aren't afraid of that. And they're not paying that much less.
No.
When they go to these places.
No.
So why are you jeopardizing your face, for heaven's sake?
That's it.
Talk about this Moxie facial.
Yeah.
What is that all about? Yeah. Or
So,
Moxie rejuvenation.
Moxie laser.
Laser.
Yeah. So I love the Moxie laser. It's not for my 80-year-old patients, right? It's not going to go after deep wrinkles. But what it does, which is really nice, is it's sort of for the busy human. You're going to get a nice laser resurfacing. It's going to go after tone, texture, pigment, pore size, fine lines and wrinkles.
I'm writing all this down. Yeah.
And you're going to be able to go to work the next day. Is
your face going to fall off in a week?
No, you don't look like Freddy Krueger. I always say that.
Because I see it. I mean, a really good friend of mine, she's so open and honest and she's out there. But I remember just before I know her, she was in West Palm Beach and she had this laser. Just her sharing. Yeah. Literally her whole face went brown crust and was seeping and oozing and just
I have that
off.
One too.
Right.
So that's the deeper you go, the longer the downtime.
But do you think that's somewhere way down the line you're needing that?
Ideally, if we get you early. That's the thing. And there's no amount, it's never too early.
So am I a candidate for Moxie or am I a candidate for the face-off?
Moxie.
Okay.
Yeah.
Good.
Moxie.
We need to have that conversation.
Yes.
So that's something. And and actually the interesting thing is, I have had Botox a couple of times on my forehead, and I've had a little bit of filler around here because, like when you lose weight, for me, there's this jowly look, and I'm, I've just drawn on my face. I'm massaging all the time to try and prevent that.
Yeah.
I'm trying to age gracefully and not do too many things, but the texture. That's the thing. And I had atopic dermatitis. So, they called it muzzle mouth. The irritation would come around here. And so the texture's affected. And if I could say anything about anything, I'm quite happy with myself.
Yeah.
But that is an issue for me.
Texture,
And I have been to see dermatologists and we've talked about these things, but I've never been left feeling like there's anything I could do about it.
Yeah.
And so this is something.
I think so. I mean, I absolutely love it. I mean, it's revolution. When I kind of drink my own juice, right?
Yes.
Like I bought it. And
hey, that's a good thing.
I bought it for me. I'm like, this is amazing. This is the best. Why would we not do this? I mean, because there's so many fluff and buff treatments out there. Women are getting facials every month, which is good. I mean, you really should take care of your skin.
I love the hydrofacial.
And it's great. But as far as seeing some like pretty serious results with minimal downtime, that didn't exist in my mind. Right? It just didn't exist.
And this is quite a new thing.
I think, it's only been really.
And so it's a laser, so it's permeating below the
skin, the epidermis. Yeah, absolutely. And it doesn't go that deep, right? If we need to go deeper, we have a different laser for that. But Kim Kardashian's done it. Khloe Kardashian's done it. I mean,
and I noticed you had fans around your client's face. So, and why is it a painful procedure?
Not super painful. No. I mean, we put topical numbing on.
And what's the difference between a Moxie and a Halo?
Halo's
I've not
deeper.
had any of those.
Halo is deeper. So Halo's going deeper. So the levels are, and we're talking. Cyton is the laser company, the laser manufacturer, and they make Moxie laser. They make Halo. They make their Erbium platform, their TRL contouring. And so the deeper you go, the longer the downtime. You talked about your friend who looked brown and scaly, and that's deep.
Yeah,
that's deep. You're out for 2 weeks. You might as well have gotten a facelift because your healing is the same.
Really?
Yeah.
Wow.
But you got to go after the skin. I can do a facelift on anybody, but if your skin is bad, that's not going to correct the skin.
No.
So we got to go after both.
And what about the threading?
I don't believe in it.
Yeah,
doesn't last.
It's interesting, and I feel like I've actually seen
threads gone wrong.
Well, I've just seen threads in people's faces. Yeah. And it's funny, I kind of look for this stuff now because, you're kind of interested in it, and they come out with this marketing that's just that. But it doesn't, it's not holding on to anything. It's just the tissue's going to erode. You've got an alien thing in your face too. Like your body must try to get rid of something like that.
Well, it's the suture that they're putting in your face is not a permanent suture.
Right.
But I've had to fix a really bad situation where the threads were too superficial and caused like some intense puckering, made a woman look like the Joker. And and we had to fix that. And it's a $45 billion industry. Aesthetics.
Yeah.
And so when you are seeing people, you have to know what their intentions are. Are they trying to make a buck off of you, or are they doing the right thing? Yeah. And not saying that threads are, the most harmful thing that can be done.
Hey, look, when a surgeon sits in front of me and says, I don't believe in them, just listen to those words.
It's just a waste of money, at that point.
False economy happening right there.
Right.
Yeah. You as a businesswoman, and you as a surgeon too, those two things, what's your future look like? You're young still, you've got this, you've got 50 years ahead of you in the workforce. What are you doing with that? Where do you want to go with it?
Yeah, that's a great question, actually. Somebody recently asked me that as well. And so what I will tell you is twofold. So the challenge is this: how do I create this model of relatability, of hand-holding with patients and grow, right? Like at some point, am I going to lose that? And that's my biggest fear, is as we grow as a business, as I get bigger, I'm only one person.
You can't clone yourself.
How do we create this model and keep this feeling in the office of boutiqueness, right? And so that I'm figuring out. But I can tell you we're growing.
Yeah, and I think it's possible. I don't know why. For some reason, as you were saying that, I thought, well, what other businesses do that? And immediately, and don't laugh at me, I thought about the Soho House chain. Because Soho House, for me, do it better than anybody else. And then, no, they're not surgeons. It's a boutique club, private club, and hotel chain. But their level of service, the intimacy, the feeling you get when you're in their environment. And I was a member in London, and I just remembered it was a quiet, unobtrusive, elegant service. I think you are, the one and only in Orlando doing what you do, the first. You can do it because you created the machine already. You just maybe have to have an academy and bring in your own women, and they won't be the one and only, but they will be under you. And I think that if, like you went out on your own straight away without being fostered by anybody else, if you bring people in straight away and they grow under you, then you're going to spread that around with you. Yeah, there's only so much you can do as an individual person. And there's going to be a point in your life where you feel like, I need a bit of my life back for me. but I still want to keep doing this thing. You're going to have to grow, and you're going to have to make lots of little mini Stephenies so that, and how is that possible? Can you create an academy kind of, that's the wrong word, training school? Is there a point where you could take these people on? Can they do the residency with you and all that kind of thing?
I think it's a value system. So I'll tell you, with the staff that I currently have, who are the best in the business, they have bought into the way that we do business. They are absolutely going to take care of you from beginning to end. My nurse, says that we treat you like, you're our grandma. Like we are literally holding your hand through the entire process. And
is this unusual?
I think so. I think so, especially because there's so much turnover in healthcare. But when you're coming into a practice like mine, this is not your average job. This is more than that. And so you really got to be a special person. And so for me, it ultimately comes down to, what's your value system when you're sitting here interviewing for a position? What drives you? Have you bought into are you prepared to buy into what we are doing? And I think ultimately that's how I grow, is just hiring the right people, which is way easier said than done.
Oh, I know.
Yeah.
And we're in a culture now, nobody wants to be hired, and it's impossible to keep people.
Yes. So that's what I'm hoping for. So
it's fantastic. Thank you so much for coming to talk to me today. I know it wasn't ideal. You wasn't feeling too great.
No,
so I very much appreciate you being here. Dr. Stephenie Poris, I'm coming to see you, but thank you. It's been wonderful. And I really learned a lot today, and I hope everyone else did.
Thank you, Carey. I appreciate it.